Broadcasting from Baltimore, Maryland, this is 5x3 Radio, where strength is for everyone. I'm your host, Emily Sokolinski, owner of 5x3 Training, a strength and conditioning gym in Baltimore, along with my co-host, Rebecca Fishburne, founder of Cornerstone Strength Maryland. Each week, Rebecca and I will discuss the ins and outs of strength training, why there is a no one-size-fits-all approach, and why strength is so important in our daily lives. Thanks for spending some time with us today. Now, on with the show. 5x3 Radio presents Mondays with Manny.
When people get older, and I'm talking about not 40s, not 50s, I'm talking about in the 60s and 70s and even 80s. So when people get older, a very, very common problem is that they begin to have difficulty walking. Now, there are various reasons, but one of the more common reasons is that their lower back hurts and they develop leg pain. Very common. And a lot of it is attributed to what they call spinal stenosis. Mm-hmm. And the way they make that diagnosis is an old person comes in and says, I can only walk like a block before I have to stop because I have to bend over, it hurts, and then I have to rest, and I can walk a little further and then it hurts. So a person goes in and they send them for x-rays and an MRI, and of course there's full of arthritis in the back, and they attribute it to what's called spinal stenosis, which means, to a doctor it means, that the spinal canals around the nerve have narrowed and the nerves are being pinched. Mm-hmm. And this is a very common diagnosis. Mm-hmm. And they send them for physical therapy. It helps a little, but not much. And eventually many of these people undergo surgery. And the purpose of the surgery is to relieve the presumed pressure on the nerves. And I can tell you the statistics are terrible on the surgery. And I believe what the real cause is that if you don't have strong muscles that will help support the upper body, and that so you're not relying on your lower back muscles, then that's the probable cause. So the treatment, in my opinion, is not surgery. The treatment is catching it as early as you can and building up the posterior chain muscles, hamstrings, glutes, and even the lower back muscles. But the main thing is building those up, and then you won't run into that problem of overloading your lower back.
Right. And
it has nothing to do with if you think about it, a fantasy diagnosis of nerves being pinched. It just doesn't make any sense if you think about it, because what they're saying is the nerve is not pinched when you're just standing still. They're saying the nerve gets increasingly pinched as you walk. What's the physiology behind that? It makes no sense. You understand what I'm saying?
I do.
And so if you catch it early, you won't run into that problem.
Yeah.
Again, this is only my opinion.
Yeah.
Okay?
Yeah.
But when I was in practice, I saw plenty of patients with spinal stenosis. My father had it. He couldn't walk, and nobody understood what that was all about. So, but what we're talking about here, because we got to make it clear, because we don't want to talk silly fantasies.
No.
Okay? We have to talk something that makes sense. It's not only simply that the back muscles, the gluteal muscles, the hamstrings are weak.
Right.
There used to be this thing called, where somebody invented it, I think, in the latter half of the 20th century, where you have to wake up your glutes. That was a common thing.
Yes.
Now,
glute amnesia.
He wasn't totally off the mark, if you think about what he was saying. Mm-hmm. What really he probably meant, and the reason why sometimes that worked, is because in addition to building those muscles, what you have to do is you have to incorporate that muscles into a motor pattern.
Yes.
If those muscles are not incorporated into a pattern, you won't use them at the appropriate time. So by practicing these very standard moves, a squat and a deadlift, the muscle learns to be part of a motor pattern.
Yep.
And so therefore when you walk,
Yep.
the muscle says, oh, now it's my turn to work.
Yep.
So the man who thought about glute amnesia was not really totally off the mark.
And it's our bodies are very smart, because when you do injure yourself, if you do have an injury or a tweak, your glutes, in a sense, will quote unquote shut off. They will prevent you from moving quickly and from doing, because they don't want you to replicate what you just did to hurt yourself. So they will prevent you from actually physically moving faster or bending over or doing something that the brain's going, last time you did this happened. So we're going to make you slow down a bit. And then once things resolve, now we're going to let you move again. So the body's smart. It will not.
But you need that motor
pattern. You need that motor pattern. You're absolutely right. It's
because,
true.
If you think about it, let's talk about two possible fantasies, okay? The first fantasy is that as you increasingly walk, your nerves get increasingly pinched. What is the physiological basis for that concept?
I don't get that.
Okay, what is the basis for that?
Right.
It sounds good when you first say it, but when you think about it, you say,
wait a minute, it's like a little gnome inside going.
Yeah, what is that? I mean, what is the basis for that?
It's ridiculous. We'd all be, if that were the case, all of us would have spinal stenosis.
Now, somebody says, well, as the muscles get more, as your body gets more blood flow, the nerves get more blood flow, they swell, and therefore they get pinched. If you put that down on paper and think about it, you have to say, that sounds like a fairy tale.
Yes.
So, now let's present another possible fantasy, that your gluteal muscles don't know how to fire at the right time. Now, on paper, that sounds, what are you talking about? That sounds like a fantasy. But if you think about the way you do all of your activities, let's talk about a simple activity. Let's say you want to play the guitar, and you want to have your fingers perform a chord. When you start doing that, you're very slow at getting the fingers in the right position.
Right.
And then as you increase it, the fingers assume that position more rapidly and more rapidly. How do you explain that? That is called a motor pattern. The muscles learn to fire in a coordinated way. That also applies in every motor pattern you do that is not inherently instinctual. When you learn something, the body learns to fire the nerves in a particular sequence. The nerves bring those muscles in when they're needed to perform the movement, and that's what it works. That's the way it works. And as if you do that more and more, those muscles that are brought in for that movement get stronger.
It's like watching a child learn how to walk.
So which fantasy are you going to believe?
Well, and it's the thing. I think the nerve. I think the pinching nerve. If someone were to tell a patient that's in a sense, the patient feels better, like knowing, okay, there's something wrong. It sounds good to them because it in a sense, it's kind of their diagnosis. Even though it doesn't make any sense, you've told somebody this is what's going on with you, even though it doesn't make any sense, but the person then believes, and they probably actually get better in a sense because
there is that that placebo, but ultimately, if you look at the statistics of spinal surgery,
but having spinal surgery
doesn't work.
No, that's where it goes wrong. That's where their diagnosis then goes wrong. Like the diagnosis is, like in a sense, quote unquote, fine because the person maybe says, okay, fine, and now I know there's something wrong with me. But if they go to that extreme of I have to have surgery, then you've done more damage than good.
In this instance,
you've done more damage.
So in other words, I'll put on the table several possible fantasies. You choose the fantasy.
People want a quick fix too. They want a quick fix. Hi, everybody. Welcome back. 5x3 Radio. Rebecca and I are here with you on this nice, beautiful, sunny day. It's now May 11th. It's 1 month to the Strong Woman contest, by the way.
Ooh.
1 month.
Yeah. We've got some gym members at the gym I'm working at locally that are going to come up and compete.
Oh, awesome. Oh,
yeah.
Great.
It'd be interesting. Yeah.
I have a lot of new names that I don't know. We've got a pretty nice group this year. We have around 45 women competing. So I know it's been a while since Rebecca and I have been with you. The last time I put out a podcast, I was solo.
What?
I can tell Rebecca this. She
You did not tell me this, Emily.
She doesn't listen. She doesn't listen to her own podcast. She doesn't listen to her own podcast. I did. I cheated on you.
I like to hear myself. You know this.
I cheated on you with my girlfriend Lynette, who is
okay. I'm a little upset now, Emily.
She's a GP in England, in Leicester.
Oh, gotcha.
She was one of my online clients back with
Yeah, I remember.
So she wanted to catch up and ask a few questions about a group program.
You were like, fine, I'll talk to you, but you have to record a podcast.
No, and Diego said, you were talking to Lynette? I said, yeah. He goes, oh, should be a podcast. Because she's actually got, it was like a catch up high, but it was also I have questions about. So we turned it into a podcast. It was pretty good. She was.
See, I'll listen to that one because I'm not on it.
Yeah. See, so listen to that one. That's the recent one. You're like, wait a minute, why am I not here? So that was the most recent podcast we did. So it's been a couple of weeks, mainly because Rebecca's very busy these days, not just coaching and training people, but she's also been in Annapolis. And I want you to tell people.
I'm actually done now. I'm done now.
Okay, you're done now. But so she's been doing this. I guess you've been interning. You've been an intern.
Yeah. So I was part of this program that's through University of Maryland that's called Legacy Leaders. So it's for old folks like myself. And there was like an educational portion where you learn about state government. And then in the spring during the legislative session, I served 2 8-hour days per week with a legislator. And I had like such a cool experience because my legislator started out as a delegate. The senator in her district was appointed Secretary of State. So then there was an open Senate seat, which my delegate ran for. Then became senator. So I crossed the street and was in the Senate. And got to see how a lot of this stuff, state level politics works. And last week, we were trying to figure out a date that we might be able to podcast. My whole week last week got like sort of thrown out of whack because Monday I found out that they were doing bill signing on Wednesday. So I was able to go down for that, which was super cool. So a lot of the bills that my senator was involved in were on the docket. So when those came up for signing, I got to be in the photos. Nice. Cool. So it's sort of like I've got these photos and some of them are total like, where's Waldo? Like I am not, somebody important in the front row. I'm not even secondarily important in the second row. So all 5 foot, maybe 1 or 2 of me is relegated to the third row. There's one photo where like literally you can.
Were you on a chair?
Ooh, I needed one. You could see my nose and my eyes and the top of my head only because I'm on my tiptoes.
Nice.
But then there was one of the bills that I got in the photo for, which was it was SB 3, which was for Maryland's 988 trust fund funding,
which is
and so this is sort of relevant to the topic we're going to talk about today. But so then the 988 number is the National Mental Health Hotline. So the national hotline for suicide and crisis.
Okay.
And so this bill just provides funding for that as part of what the governor has to set aside in his annual budget.
Fantastic.
So that photo, you can actually see me because the Secretary of State was like, come on up close to the front. You're short.
I need to find that one. I'll have to put it up on the podcast. I don't know if I can. I don't know if I can put pictures up or not, but somehow we need to.
That one you can actually see.
That's
me.
awesome.
And then there's like one photo where I look absolutely like starstruck, stupid.
I had
shaking hands with Governor Westmore.
Was that was last week or this? Or
so that was last
week. So I had no idea Rebecca was
May 3rd.
Okay. Excellent. Yeah. I had no idea Rebecca was. I knew she was in Annapolis. I knew she was interning down with her delegate, now senator. but I did not know that she was a part of this bill signing. When I texted her earlier this week about a topic, I actually got the topic from my intern at the gym. I have a new intern. I asked him for a topic. He said, well, this month is Mental Health Awareness Month. And I said, that's a great topic. And told Rebecca, I want to do this. And then had no idea that,
then I surprised
that you surprised me with your
policy.
So this is kind of all coming together. And I'm sure that that was part of it. They know. So the signing of the bill, probably because of May. So we thought, since this is kind of on point, Mental Health Awareness Month is the month of May. Rebecca and I thought we'd just discuss our own experiences with mental health, and also help our clients who have experienced bouts of depression or anxiety. And disclaimer, we're not doctors. Obviously, we're not doctors. We're not physicians. We're not psychiatrists or psychologists. We don't dispense medical advice here. This is strictly our own experience, our own personal opinions, what we have gone through, what we have seen any of our clients have gone through, and just some ideas of maybe what you can take away from this podcast today for your own self. If you yourself have ever dealt with any type of mental illness or depression or anxiety, or maybe others in your immediate family or friends, but again, not doctors or physicians, strictly just our own personal opinions on the matter. So so the bill is just for funding. The bill that you signed was for funding. Yeah. Funding for what? Go into a little bit more detail about that if you can.
Yeah.
If you know.
So the 988 hotline, similar to 911. Mm-hmm. Like if you're having a 911 medical emergency, this would be a corresponding similar number that you could call if you were having an emergency that was a mental health related emergency. So a crisis or suicidal ideations, suicidal thoughts. Okay. And we're looking for help. This would be a number that you could call. It's free, confidential crisis resource. I think there are 8 organizations in Maryland that have been part of the 988 network, providing this sort of counseling, confidential crisis counseling, trained counselors on the other end of the line that are just available for people 24/7. Because especially recently, I think it's hard if you're trying to get an appointment with a psychiatrist, a psychologist. Wait lists are long, even with telemedicine. I think that kind of often makes it easier for people to get in for appointments, but there's still just like such a need, and I guess not as many providers as are needed at this point.
So now there's a hotline that people can obviously utilize now to kind of get at least talk to somebody, because I don't think it's there's a big stigma, obviously, right, with mental health. I think it's maybe more and more these days it's becoming, there's more awareness of it, and there's more need to realize that this is real. These people are not just going to snap out of it and when they feel better. But there's still this kind of, we don't talk about it. I do feel though that many of my clients who are in therapy, let's say, do actually talk about it. My therapist says this, my therapist says that. There's a lot of that going around. But at the same time, they're at the gym too. And there's a big part, exercise plays a huge role in not just our physical well-being, but our mental well-being too. And I think that for me, definitely over the years, exercise has been huge in keeping me sane, keeping me on a schedule, keeping me, regimented, so that
things regulated.
Exactly. And you can't always just work away your pain, but it does have so many more benefits than not. And this is definitely one of those, because getting to the gym sometimes can be half the battle. Getting out of bed can be half the battle for many people. But I think strength training has often helped. It definitely has helped many of my clients who have talked to me about their own anxiety and their own depression. It's definitely helped them kind of get onto a schedule, right? Feel like they're in control of their bodies. They're in control of something. They don't have to worry about anything when they're there because there's so much to take care of. It's not mindless. It's actually mindful lifting, right? It's mindful. I've written a blog post about this about 4 years ago. I wrote a blog post about it, so I can talk about that. But what has been your experience with your own? Because we've talked about our body dysmorphia and our eating issues in the past, and what's helped, and how the strength training and getting stronger has helped us. Have you dealt with any anxiety yourself over the years? Have you had to deal with finding, a better way to deal with depression if you've experienced that?
Yeah. Sure. Make me go first. Emily. You're the one who wrote the blog post.
I can jump in too. I can go first.
Yeah, I'll go second. You go first.
Well,
Emily, why don't you tell us about your blog post?
Well, okay. I was telling Rebecca, I pulled up my old blog post. I wrote this in 2019, and it was a year after I had had a really bad meltdown. So that was 2018. And the quote that I have at the beginning of my blog post actually is, I have to credit Terry Bradshaw, who's the NFL football player. Depression is a physical illness. And I forgot how I got that. I'm like, how did I find that wonderful quote? And the whole quote is, depression is a physical illness, states Bradshaw. The beauty of it is that there are medications that work. Look at me. I'm always happy-go-lucky, and people look at me and find it shocking that I could be depressed. And I think that was a big, that was definitely me on the surface for many people, right? They would see one thing, but they didn't see the other side of me during a time that was really, really rough. It was after my sister had died. And that was obviously anxiety-ridden traumatic event, right? That happened in my life, especially since she had cancer, and for 3.5 years. So it was kind of leading to that. Unfortunately, I was hoping not, but unfortunately she died in 2015. And it was a real roller coaster ride. And I kept training and I kept lifting, but I kept finding myself kind of quote unquote sick every Thanksgiving or Christmas or, her birthday or Mother's Day. I would always be quote unquote sick. And after a while I realized.
So, wait, what do you mean by that? Like, what would that be?
I couldn't get out of bed. I didn't want to get out of bed. I had no appetite. Typically I had no appetite. I couldn't eat. I didn't want to go in and train. And I don't think I did, which was definitely something that I probably needed to. And maybe I went in and felt really bad about my tracking. That often was the case too.
Like low energy.
Real low energy. Things hurt. A lot of that. A lot of achiness.
Yeah, but all of that, like it all sort of, all of those different pieces,
right?
So the low energy, not wanting to get out of bed, not wanting to eat, physical pain, and and it wasn't until 2018. So 2015 is when she died, and so 3 years later, I've been kind of, training and trying to keep everything moving and keep the gym moving, and then in 2018. I remember this clearly. I wrote this in my blog post. It was October of 2018. I had a doctor's appointment, just a checkup with my doctor, and it was raining and I was miserable, but I went to the gym because I knew I couldn't get my training in because I had an appointment. And that was very crucial to me, right? That made me feel better. Keeping a routine. I think that's the routine, right? Even though I didn't feel great, I needed to go in and do something because I wanted to keep my routine, but pain was like shooting through me. I couldn't squat. Everything ached, everything hurt. And I was like, what the hell is, this is not right. So I finished my training session, went to the appointment, sat down with the nurse, she took my blood pressure, and then she said, have you been feeling depressed lately? They ask you the question. Right. I always answer, no, I'm fine, right? I answered her, yes, I have. And she made a note. And then about 5 to 10 minutes later, my doctor came in. By that point, I'd lost it.
And I was just crying hysterically. So she came in and she sat down and she basically said to me, now you've tried the weightlifting, non-pharmaceutical aspect of this. She took one look at me and she said, would you like to try the pharmaceutical aspect of this? Right. And that's the one thing that we definitely people don't want to talk about, but it's not just there's a quick fix, but there is a little bit of a push. Right. And she knew that the strength training was important to me. And she knew that I was using that as an outlet and as a ways and means of helping myself. And she was right. And it was, but it could only do enough, right? It could only do enough. And this is just me personally, right? And it wasn't an immediate, well, actually it was pretty immediate. It was pretty quick. It was pretty clear right after she decided to put me on something that things really calmed down. Not to say I didn't have any crying bouts after that, or, I didn't think about my sister. Of course I thought about her and I still had moments, but they were fewer, right? There were fewer.
Sort of like leveled things out.
I was way more in control, right? Way more in control, and realizing that I had spent so much energy trying to not go that route. And yet having that combined with my strength training, with my regimen, with my exercise was crucial. Was just needed. And
so it's sort of a both and approach as opposed to either or. It's not
right. And I think
have to one or the other. No. They can work in tandem.
And I think that starting out with maybe strength training for many people is a good path, if that's something, just to kind of get them into a routine, make them have to get up, get dressed, see somebody, right? I have plenty of clients who getting them into the gym can be very tough, but they know that when they come, they're going to see me, they're going to see people that they like, they have a routine. And that is something that is very important for keeping that, helping you, define a path for yourself if you deal with any type of related, mental instability.
Well, so it's interesting you're talking about resisting the pharmaceutical route or the medication route for a long time, because I think that's a lot of people kind of have that.
Sure.
That bias. And our pediatrician always talks about, medications for various issues that my kids have faced or other of his patients have faced. And he always makes the analogy, like if your kid had less than 20/20 vision, you wouldn't tell him to just try harder to see what was written on the board.
Right.
You wouldn't tell them to tough it out and squint more.
Right.
You would get them a pair of glasses.
Right. Right. Exactly.
So you'd get them a prescription to help them see better.
Exactly.
So if a person is struggling with depression, why the different standard? Why not say, okay, hey, look, there's some prescriptions that could possibly be helpful. Let's see if this prescription helps.
I think there's a stigma there with some people, and I think it's many people who see that as weakness. It's a weakness. Like, you shouldn't feel that way. Why can't you just, I don't want to use it, woman up, man up, right? Why don't you just, like you said, just snap out of it? Like, is your life that bad? Well, no, it's not that. It's not that.
I mean, there's so many things there, right? Because just culturally, I'm thinking about my grandfather having come back from World War II and had a lot of PTSD. He was in, he was storming the shores of Normandy, but came back and didn't talk about it. Lots of that trickled over into, family dynamics. But, in that day and age, PTSD wasn't a thing that people discussed. They didn't talk about what happened during the war. They just kind of kept it buttoned up, and it came out however it came out. And so I think generationally, we have changed, our culture has changed, is more open now, but you still have, I still kind of grew up with some of those ideas.
Of course.
Even though I think my kids less so, or have those sort of, keep it buttoned up ideas.
Yeah. I mean, I think people, talking about it, I don't know if it's people they don't want to talk about it because they don't want to burden somebody about it, or it's not worth talking about, or I should just put it out of my mind. I really need to get past it.
It's not worth talking about it. That's another place where social media kind of doesn't do us any favors, because, or I mean, even just being aware of what's going on in the news, right? Like people often, it's such a first world problem, right?
Yes.
Like dismissing how they're feeling or what they're going through, because compared to a lot of the crap that's going on in the world, okay, where do I stop feeling bad?
Right.
I have all, and that's
I said that
the reality of the person's situation.
Yeah, I said that to my therapist. I mean, I'm not seeing one right now, but I was for a long time. And I remember sitting there and I said to her, I can't believe I'm talking about this. There are so many other people who have so many other issues. Why am I talking about this? And she looked at me, she said, because this is your issue, because it's your problem. And that's okay. And someone giving me that permission to kind of feel that way was everything, because it wasn't yes, there are, but this is your issue and you're here and we're dealing with this and you. So it's interesting. I didn't think that I needed this. So I've been on medication since 2018, and I didn't think I needed it this past September. I was running out, and I just let it run out. I didn't have another refill. And I was like, you know what? I'm feeling great. I don't think I need this anymore. So I went off of it, just like that. They're like, you need a taper? I'm like, taper? There was such a small dose to begin with. There was no taper, And I contacted my doctor and I said, I'm going to go off. She's like, are you dealing with the withdrawals? Okay. I'm like, yeah, I'm fine. A couple things here and there, but nothing major. Holy cow. The floodgates, after a couple weeks later, I was saying stuff I never said before. I'm just like, I'm bawling my eyes out. I'm having anxiety dreams. And Diego was like, yeah, you might need to go back on that. I just said, so?
Or at least have some guidance as to how to go off it.
Right. And the first time around, before I went on it, he said to me, and I remember trying to do something and everything hurt. He said, you either have rheumatoid arthritis or you're depressed. So you need to go see your doctor. So now he's like, I think you might want to go back on that. And I was like, I think you're right. I have a prescription. I actually picked up a prescription. So I had a full, prescription. And within about a week, 2 weeks, I was back to my old self again. It was that clear. And it was so clear that the reason I felt good is because I was on something and it was all that anxiety in me. I'm talking because over the years, I mean, I had a major panic attack once in 2008 in Columbia, Maryland, after a dance rehearsal when I was school director, and I couldn't drive home. I didn't know how I was going to get home because I'm in my car crying hysterically, and it was midnight. And I'm like, how am I going to get home? I finally calmed myself down enough to drive home. So, this is not something that's just that just happened all of a sudden, but it definitely, as a result of the trauma, that occurred, 8 years ago, clearly, something had to happen. Do I still strength train on a regular basis? Of course I do. It's still just as important. It's a lifestyle, right? I think many people are on this new obesity drug, Ozempic, right? And they're losing weight. I know a couple people who are on it and they've lost an extreme amount of weight. It's amazing. It's remarkable. And they feel good as a result. But it's not just, I think they realize that lifestyle has to happen too, right? There has to be a change in just how they conduct themselves with their eating. And now that they have kind of shifted into this, I'm not hungry as much anymore, right? So I think there's still, even with medication, keeping a schedule, learning how to really regulate yourself and self-regulate yourself is obviously so important. But it's amazing how many people do decide that they don't want to have that help, thinking that they should just be able to do it for themselves. And I think that's really that's kind of the key. But I think the strength training portion of it, just the exercise portion, I mean, studies have shown, it makes you feel better when you physically move your body. So it's not a drug, but I think it, obviously
You
has
mean the exercise?
the exercise,
The
right?
medication is.
The medication certainly is, but the exercise,
Yeah.
is it we call it kind of right? We talk about it as a prescription, right? Because Sully's book, about prescription. So in a sense, it's kind of like it's an exercise prescription, right? But it's not a prescription for everything. But it definitely should be included in, within your regimen. So that's my blog post. That was from, that was from 2019. And that's my, and I don't keep that to myself. I think many of my members, my clients, people who know me well, know that about me, right? I'm very open about that because it's helpful to know that we've all kind of been somewhere, and the steps that we've taken to help ourselves find a better place to be. So, yeah.
Well, and you're talking about, one of the issues, I guess, that comes up for people is this sort of bias or this thought that they can just work their way through it, or I don't really need help. I don't need a therapist.
Right.
I don't need a prescription, bias against mental health issues or whatever. But I think also, at least a lot of times in my case, when stuff has come up, it's been more a situation of I don't actually realize how bad it is in the moment. It's not until I come out the other side that and I have a little perspective that I'm like, oh, that was pretty bad. I probably should have been looking into getting some help. So I think, that's not necessarily a bad thing, because when you're in the midst of a trauma or a depression or whatever it is, that's not always the best time to be. You are trying to just get through it, and having counseling and having help to get through it is one thing, but it's also useful after the storm has passed to do some work to try and build the skills, build up the toolbox, to help, first of all, just recognize, sometimes even just recognizing when past trauma gets kicked up, or when you're going through a bit of depression. Sometimes we don't even recognize it in ourselves while it's happening. But then also building up some tools and skills for dealing with that when it comes up. So even if you are sort of, better at identifying, your mental health issues in hindsight, like I seem to be, that's still, I think, a good time to, investigate, dig deper, learn more, do some work.
Yes. Even if it's just so you recognize it in hindsight, well, you have a better idea of, like, let's say that it occurs again. You see it differently. You're able to step back, acknowledge it, and decide how you want to pursue, handling this. What's the best, you've been there before. What didn't work? What might work now? I think, keeping it to yourself can be destructive.
Yeah. Well, and I guess, the other thing too, it's like, I've gone through various phases with stuff in my life. Like in my 20s, I was sexually assaulted. So that was like a really difficult time. And I struggled to get through all of that.
Right.
And then you think that that's something that's in the past, but, and I went through counseling and therapy after that happened. But sometimes there are current day situations that pop up that somehow in your subconscious reflect back to you what happened. And it may not be a very obvious direct parallel, but something like that, like the power dynamics or lack of control, those sorts of things can sort of mirror back to you things from your past that maybe you think you have resolved, but you haven't really. And that sort of situation can be surprising.
Yeah.
Because it's not the exact same thing, but the same feelings of lack of control, feelings of like power struggles or any of that sort of thing. And so just being able to like dig deeper into like those sorts of dynamics, so you recognize them when they come up in other circumstances,
right,
and can be helpful. And being able to talk about stuff like that, whether that's with friends, whether that's with a therapist, helps get past this like this shame piece that goes along with a lot of not just like an assault, but also like mental health issues.
Right.
People a lot of times feel some shame, and that kind of feeling makes it even more isolating, which just snowballs things.
Yep.
So it's like if you have a good network, and sometimes that network is like friends at the gym, sometimes it's a therapist, or friends not at the gym. But a good network, or if you don't have a network, you're looking for a network, the 988 crisis line.
Yes.
A good place to turn and learn about other resources.
Yes. No, I mean, it's I was thinking about something as you were talking. I think it went out of my head. It's the talking that I think many people don't want to talk about it. You ask them, how are you doing? Oh, I don't want to, nothing. I'm okay. Nothing. Well, you want to talk about it? No. Yeah. It's okay to talk about it. Like, it's not something that it's, but I think sometimes not talking about it, maybe it'll go away if I just don't bring it up and I don't think about it.
Yeah. And so that works fine until it doesn't work. Right. And so that's basically what happened with me over last year. Right. So some stuff going on in my life with power dynamics, with like nasty people, just kicked up a whole lot of stuff that I was like, I have dealt with this already. But really actually not.
Right.
So it was all fine until it wasn't.
Right.
And so during that time, it was like, like that sort of, it affected my behaviors. I did what I think a lot of people do, which is the wrong response, like temporarily dull it with like, okay, hand me another glass of wine.
Yes.
Kind of thing.
Yes.
Then that affects the training, right? Like you had your sick days. I had my self-imposed sick day.
Yes.
With my training, where it's just like, I did not deal well with this situation last night. I'm paying for it now. My lifts suck. I know exactly what happened, but really, like, there's the underneath stuff that needed to be addressed a little bit more. But like I was saying, sometimes you can't deal with those things in the moment. You have to wait for the situation to settle down so that you can start to dig into it a little bit more and figure out what it is that sets off the poor coping techniques, so you can learn to develop better coping techniques.
I think I'm thinking back to, this is not my first bout with taking any medication. I've taken it in the past 2 years. I mean, you're talking probably about 20 some years ago, when I was teaching. I had severe anxiety. And I think part of that is just my personality. I joke that I'm a type AAA personality, and it's good for many things. Like, I get shit done, right? I have a thriving business. Things are going well. I'm able to, stay on top of things. And I've done so many things in my life that have all kind of culminated into where I am now. But as a result of that, I've pushed myself to the edge. I've put myself out there so much that I put myself ahead of myself, and I don't get back in return what I've put out, and realize, I've wasted a lot of energy, and sometimes, and then that makes me mad. So I've been on and off, usually anxiety medication, because I just am such a gotta do this right. Everyone's got to know that I'm doing it right kind of thing, right? Get the pat on the back. Diego says, you always need that pat on the back. I do and I don't these days, right? And I'm a lot better. I've mellowed out a lot as I've gotten older, but when I was younger, a lot of proving myself. And I didn't have the outlet that I have now. Yes, I had the gym sometimes, but I didn't, and I had my dancing, but that wasn't enough. There's something different about what we do now, right? What we do in the gym now that really managed to help me, especially through Charlotte's illness. And then subsequently into, after she died. It wasn't, like I said, it wasn't until at least 3 years later, and I hadn't been on anything for so long, and I'd gone into therapy. So I had that. So I was talking about things, and that made me feel a lot better. So I was able to at least I had this one outlet. I had the strength training, and that was everything. It made a huge difference. It can make a huge difference. It's just that it didn't make enough of a difference after a while, right? I think there's just too much happened, over the course of the time, that seemed to be one of the biggest trauma in my life. Other things were not that traumatic. They were just shit situations, with people. This was a bigger deal. And I think it called for something more, but I don't know if I'd had the gym as I have now, if I had the strength training program that I have now, would I have fared better in those situations? I don't know.
Yeah, it's interesting.
I really do.
I think about that with like different types of training, and I think we've talked about this before because, I started out as a runner, distance runner,
right.
marathon, that sort of thing, and I did that all through my 20s and 30s, and it was very much like I don't know, running away from things.
Right.
Feeling like
I remember running. I didn't mean to interrupt her, but yeah, I think when I broke up with an ex-boyfriend of mine, oh my God, I started running after that. To like kind of basically, run away from from my issues.
There's like metaphorically, it's like you're running away from something. I mean, also at the same time, you're getting that endorphin release. It makes you feel better. It like releases some of the anxiety or some of the stress.
Right.
But I think about that sometimes in terms of like people talk about fight or flight, right? So strength training to me seems more like a fight sort of response because you can't run away from the heavy bar on your back. You got to like push back against it. So, and when I'm really in kind of I always just say in a funk, as opposed to depressed. I don't know.
Yeah.
Maybe that's sort of, but like it's sometimes hard to gear up to go to some strength training. Not really. Whereas like going for a walk or going for a run where you sort of get that endorphin release and the stress sort of dissipates, it's a different feeling. And I think, for me personally, I think I need both and the effects of both types of training in my life. But yeah, I didn't have, like you're talking about, I didn't have strength training back when I was in my 20s and 30s in any way that was I mean, just like the idea of being strong enough to stand the weight, and just the difference between that and running away from an issue, or a problem.
Yeah.
Just,
Yeah. No, I think. I mean, I think about this. I think about it. A lot because I do have quite a few people I know who deal with a lot of the same stuff I deal with. And they've taken it upon themselves to get help and to make it work. And at the same time, continue to try to, get their, know that this work that they're doing, this training that they're doing, this movement is really is so helpful to them because it makes them physically stronger, but also more emotionally and mentally. Because they have to push this heavy weight. They have to kind of break through a barrier.
There's like, you get like the sense of accomplishment, you get the routine, you get the sort of something that you're in control of to some degree. I mean, some days weights don't move.
Yes.
But like you're in control of showing up. You're in,
always.
So all of that, I think, helps create a structure that is helpful.
Yeah.
Or predictable or reassuring.
Yes.
In some in some ways.
There are many. I'm going to go through before when I load this podcast up and put it out. I'm going to put the link to my blog post out there. But I know that there are quite a few articles on the Starting Strength website too, about strength training and depression. And I'm going to link to those as well, because there are many people who have shared their their stories with dealing with depression or anxiety, and what strength training has helped them with. As you said, any exercise, whether it's walking or I think both, like you said, I think both are needed.
Yeah. Well, I think we tend to, separate the two, right?
Yeah.
Like mind and body, two
Yes.
separate things.
Yes.
We're all part of the same organism. You've got to, they both kind of go together.
Yeah, that's why I think I really like. I have an article up. I'll link this one too. The Terry Bradshaw article was written by a woman in 2009, and having that quote, "Depression is a physical illness." It's not mental. It's not just mental. It's physical. It
because your brain and body are
they're all the same thing.
Organism.
Same exact thing. That's why I think when people talk about mental health, it's not just mental, it's physical too, right? It's physical health as well. And that's why that's the physical part of health is important. Getting yourself out there, making yourself have to work, making yourself have to stress in your body. That's where that physicality component comes in. The mental part is, the medication, and the physical part is you giving your body what it needs, and much needed movement, movement and energy. It's amazing. I started working with one of my clients' mothers. She's 85 online.
Nice.
That's a trip. Just trying to get the 85-year-old to set the camera up just right so you can see them.
I can imagine.
And we just started on Saturday, and I'd seen her. She came to visit, a few months ago, and I came to see her. She came to see me, or she came to visit her daughter, and we worked a little bit. And she was she was over the moon with how she felt. She felt like she had her body again, like she wasn't old. She could still do something. So we met on last Saturday, and we've spent maybe literally 15 minutes just doing something. But just a couple of things that she did, she said, "I already feel so much better. I can't believe how good I feel." It was that instantaneous. Just that little bit of movement, just a little bit of squatting up and down off of a chair and doing some dumbbell presses made her weak. She went from feeling one way to feeling, wow, I can't believe how much better I feel. It's like, yes, and you can still feel that way. So that's where that movement component comes in, which is so important. And then on top of that, if you need that extra bit, as my doctor said, you've been doing non-pharmaceutical work with yourself. How would you like some pharmaceutical work? So, yeah. The article about Terry Bradshaw, I definitely want to link to it, because I think it's a good article. It's very short, but it speaks to just everything that we've kind of talked about a little bit today, and I'll link to mine. Thoughts to wrap it up.
Yeah, I guess that's kind of where my head was at the moment too. But I guess just like with everything, there's a little bit of experimentation,
Always.
Figuring out what works for you. So being open to various possible solutions.
Right.
It might be exercise, it might be medication, it might be, friends to talk to, being outside in nature, getting off of screens.
Mm-hmm.
Lots of things in various combinations can help.
Yeah.
But just being open to different types of different solutions.
Yes.
And then also just awareness.
Yes.
Working on things when the going's easier.
Yeah. Yeah. And also, being okay with maybe switching up your routine. So maybe you're doing a strength training program and you're, doing X, Y, and Z, but somehow something's going on in your life and you're finding it kind of stressful to make it to the gym. And so that's making you stressed out because, you can't. Well, it might be that you need to switch up your routine. Maybe your routine right now is not helping you with the schedule or any issues that are going on in your life. So make your training kind of complement what's happening right now. That may mean pulling back from 4 days to 3 days. That may mean going from 3 days to 4 days, maybe to shorten up your sessions, maybe doing a little bit less, maybe doing more conditioning, maybe, doing more circuit training, more bodybuilding, something else, something that's going to make you feel like maybe you need more work to do, right? Because you just want to get a little bit more energy out. It's taking a break from lifting heavy, pushing just a little bit, get in there, get out kind of work. That may be what people need at times. I think it's not just, I need to get in there and do my routine. Well, your routine might actually be the cause of some of your anxiety, in addition to the anxiety that you're facing. So, there's that too. I mean, the day that I couldn't squat, everything hurt. Well, why was I pushing myself? Everything hurt. I should have seen the signs and backed off and tried to kind of reestablish a routine that was going to make me feel good when I went in there. Signs like that, signs that maybe something needs to give. We've talked about stress before. I think that goes along with it too. When we're feeling stressed, it manifests itself in many different ways. Some of that might be trying to switch things up then.
Because I think a lot of times, well, I mean, like we in strength circles, we give a lot of airtime to the idea of the stress that you impose on your body when you're doing the training, the stress recovery adaptation cycle. And we talk about that primarily in terms of, are you getting enough recovery? What's your sleep like? What's your nutrition like? Hydration, that sort of thing. But like the amount of stress that a person is feeling because of work or because of family or because of whatever, their own anxieties or, any of that stuff also plays into it. It affects the way you sleep. It affects the way your body feels and moves. So that also is just as valid a consideration as, did you get enough protein?
That's right.
That's the problem. You need another 50 grams of protein.
Just eat more. Just eat more.
Eat your way through it. That's a whole other issue.
Just eat more.
Go eat your emotions.
Just eat more. That's never, and that's never a good solution. Well, I mean, not always. Sometimes it is, but I think it's acknowledging what's going on with you and having and making sure that people in your life will help you acknowledge it too, and not dismiss it. I have someone in my life who likes to dismiss it. This person's getting better about, accepting it. No, it's not my husband.
I did not think it was.
That was my husband. But it's, so accepting it and someone just acknowledging that you're going through something and acknowledging that maybe what you're doing isn't working. So what could help? What could help? Those are my thoughts on this Thursday afternoon in May.
Yes. Well, Emily, I will send you this photo.
Okay.
It's not quite so Where's Waldo photo.
Where's Rebecca photo?
Yeah. For the 988
Awesome.
Trust Fund funding.
Oh, you know what?
See if you can link to that.
Do this for me too, because I want to list this on the podcast too. Can you send me a link to that? I mean, I can list the number, but can you send me the information about that number and about, like, I guess the hotline number? Because I'd like to share that. Sure. Often people will share at the end of an article of it, I'd like to share as much with that as possible. I think this is one of those podcasts that, yes, we're talking about strength training, but it's kind of a little broader picture, a little broader topic to discuss. And again, not doctors or physicians. This is our own experience and just something that we wanted to relay to everybody and kind of put it out there. And hopefully, if you're experiencing anything like this has helped you kind of get a better idea of what's going on with yourself or maybe what's going on with somebody else that and care about. I think we can probably wrap it up there. I think so. I will list the information on the podcast links once we put this up. And I'm also going to put out the information about the Charm City Strong Woman contest. Our fundraising has begun. We're again, like I said, a month out from the contest. So I have a page, and a couple of the other women have pages set up too. We also have a charm. We also have a t-shirt campaign that might be ending. It might have ended by the time this comes out. I've got I think I have like another week or so with that. But the donation page will be up at least through the contest date. And so I'll have the link to that. I do want to do a shout out to your client, George.
Oh, did he do another
Who
donation?
always makes a lovely donation. So thank you for that donation.
Thanks, George.
To the Charm City contest. Always grateful for your support. Always grateful for everybody's support who does support the Ullman House through Charm City. So June 11th, 2023 is the date, it's a Sunday. If you are close enough, you want to come by and see it. For those listeners, or if you just want to make a donation to the Ullman House, you can make it through my page that's listed on the podcast site. And I think that's it. We'll end up here and see you guys, or not see you, but you know what I mean. Be back.
Catch you on the flip side.
Be back in a couple weeks, and I promise that it won't be just me cheating on Rebecca again, like I did with Lynette. But
yeah, okay, like.
It was a good talk. It was a good talk. All right. Thanks, everybody. Have a great week, and we'll talk to you soon. Thanks, Rebecca.
Take care.
Bye.
Bye-bye.
Thanks for listening to 5x3 Radio with Emily and Rebecca. If you like our show and want to know more about 5x3 training, please visit us at www.5, that's F-I-V-E, the letter X, the number 3.com. You can also find us on Facebook and Instagram. To learn more about Rebecca, please visit her website, cornerstonestrengthmaryland.com. Thanks for listening and have a great week.